I'd like to welcome Roger. Roger, are you here? And then we have from the Ministry of Health in Bangladesh, I believe Dr. Azad is going to join us. Oh, there he is. Dr.
Yes.
Azad.
Yes.
Nice to see you
Yes,
again.
thank you very much.
And
yes.
I'm sorry you were delayed. You got. We were glad you were able to join us using ICT, which is the topic, as you know, of the discussion for the last 2 days. And Dr. Azad is very experienced in this area. Participated last year in the ministerial discussions and at the UN, and so we're very happy to have you back. So this was a session that was initially entitled a Ministerial Forum, but I'd really suggest that it's a focus on the public side of the public-private partnership. We had a discussion that began with Dennis O'Brien and others throughout the last 2 days, talking about what the private sector needs for a successful, mutually beneficial public-private partnership. So we're going to spend a few minutes hearing from some individuals who represent different aspects of the public sector and ask them to introduce themselves, which we'll do in a moment, and then say a word about their perspective on the public-private partnership successes and challenges from that perspective on the public side. So I'd like to begin by asking Dr. Azad in Bangladesh if he would be kind enough to introduce himself and say a word about your experience with public-private partnerships in Bangladesh, where I know you've had many successes, but I imagine you had many challenges. And perhaps you can share some lessons learned about that from your perspective, sir. Thank you.
Okay, so thank you very much. And to you, I also congratulate all the speakers on the dais and all the audiences. Actually, together you are just at the end of making your summit a success, great success. Let me at the beginning actually apologize on behalf of our Honorable State Minister for Health and Family Welfare. Actually, he is in a foreign trip, and actually he could not actually make it available. Might be possible to attend your conference physically. So to fill out the gaps, actually I am representing our Honorable State Minister on behalf of Ministry of Health and Family Welfare of the governments of the People's Republic of Bangladesh. So let me at the beginning, for the actually interest of the audience as well as for the interest of the co-speakers, introduce myself. So I am a medical doctor and I was the professor of the medical school. Now actually I lead the team on behalf of the Ministry of Health and Family Welfare to introduce e-health in Bangladesh. So I am representing the Ministry of Health and Family Welfare. So we have begun our journey in 2009, and that time we didn't have e-health, even the email connections in the health organizations. But during the last 5 or 6 years, actually we have been able to actually successfully connect all the community health workers, all the community clinics. The number of the community health workers are 24,000. The number of community clinics are 13,000, and other daycare facilities, and the primary care, secondary care, tertiary care, specialist care hospitals with internet and computers. So in Bangladesh, actually, before we have started this health information journey, we have seen that actually the healthcare delivery system is fragmented, because in Bangladesh, actually there is a strong presence of the private sector. And actually people have the choice to actually select whether they will go to the private sector or they will go to the public sector. And the health information system as well was very fragmented. And every stakeholder used to collect information according to their own channel. So at the national level, actually there was no mechanism, there is no actually means that will get all the data together. So what we have done, and let me also explain in this connection that actually how the health service delivery in Bangladesh is given. And normally we can actually, we can classify the health delivery into 2 different types. One is actually the preventive services. That means the maternal care, child health care, immunization program, vitamin A capsule distribution, etc. Another one is curative service delivery. So for the preventive care, the actually government with collaboration with the NGOs and the development partners and implement these preventive care services. In the curative service, government has got good healthcare network, but also there are private providers and NGO providers. And the people have choice to go to any provider. So actually, with regard to service delivery, especially the preventive care and collections of the health information, what we have done actually, we have made an arrangement that the NGOs and the development partners, they will collaborate with the government. We have set up a national data center, and actually we have distributed this connectivity throughout the country. And we have asked upon the NGOs that they will work with the government so that actually we can use one electronic form, one electronic system, and one data center to collect the data. With regard to actually educating the community health workers, as well as educating the common people using the ICT, actually we are using the common ICT platform installed by the government of Bangladesh. And we encourage the private providers, particularly the NGOs and development partners, to make contents for us and to host these contents into our national data center. So this is how actually we manage those, we collaborate. Regarding collections of the data from the private providers, we also encourage them actually to use our health system so that all the data are actually can be connected into the national data center, and actually general people as well as all the stakeholders, they have got access to the data. So they can actually view our database, they can extract the data, and actually they can analyze and disseminate their data by their own ways. So actually this is in short how we are collaborating with the private sectors being in the government's actual position. Thank you.
Thank you, Dr. Zat. We'll come back to you with some questions and follow-up in just a moment. I'd like to turn now to Dr. Mwenizi, how was that? Who is the mHealth coordinator for the Department of Health and Health Services in Tanzania. And so she'll like to share her experience with public-private partnerships.
So I switch on. Good evening. Sorry, I have flu, so and with the flight and the cold, I came with it from Africa, but it's not SARS or Ebola. It's just flu. Yeah. So
more contagious.
No.
But not lethal.
Okay, thank you. So from the introduction, my name is Mwendwa Eunice Mwenesi, and I work with the Ministry of Health and Social Welfare in Tanzania. And my role is to coordinate mHealth activities and initiatives in Tanzania. And I've been working on this task for the past 5 years. So I had an opportunity to meet very important international leaders in mHealth like Patricia so many times. And it's my pleasure to be in this forum. And I think it's a very important forum, especially in this era that we are trying, especially in developing countries, to see how we can also use technology to speed up the delivery of healthcare services in our countries. So maybe I'll just give a brief introduction of what is going on in Tanzania. Basically, in Tanzania, we are also in a very important stage of implementing mHealth activities, e-health in general. And as other countries, developing countries, we are also having a lot of pilotitis of phase 1, or I don't know how we call it, but we have we have a lot that is going on in mHealth. But basically what we have done as the Ministry of Health, we have managed to bring up all mHealth practitioners, organizations who are implementing mHealth activities into one forum. We call it Tanzania mHealth Community of Practice. And we use this forum basically to share and learn from each other, and also see how we can collaborate and work together so that we do not reinvent the wheel. I think we have been talking about this, now and then. So we are trying to work on that. It's not easy, but because we have this forum, we have the opportunity to discuss and see how we can go forward. But also there's a lot that is going on in Tanzania, and as I've said, we are also experiencing the rapid growth of mHealth activities as other countries, and also the country has witnessed cost-effective and time-saving to service providers by the use of mHealth applications, and especially in reporting to higher levels, and through use of mobile phones. But also, we have seen a very big change in access to health care and health information, especially in tracking patients, accuracy of diagnosis, and also increased access to education, especially to healthcare workers. And mHealth has been very effective with the community health workers. We have very effective decision support tools which have been deployed to the community health workers, and it's having a very big advantage in tracking, especially pregnant women in the community. And we have a very active organization, GETHealth. We had Mark Mitchell here. He's the CEO of GETHealth. And it has been, hi Mark. Yeah, so GETHealth has developed this application which the community health workers are using it to track pregnant women, especially those who are within the community. Because as we know, in Africa we have a very low rate of attendance to antenatal clinic, especially in the first trimester and second trimester. So the tool actually, what it does, it helps the community health worker to register the women in the community, and therefore at the end it helps the community health worker to advise the woman the importance, first of all, of going to the clinic for the antenatal visits, the 4 antenatal visits, but also advising the woman the importance of delivering at the healthy facility. But not only that, it also tracks the woman if she has delivered in the healthy facility, and also it helps the community health worker to refer the woman. Even if she hasn't reached the 4th trimester for delivery, it helps her to pick up the danger signs and advise her that I think you should move close to a healthy facility because you have danger signs which you cannot wait up to the late stages of pregnancy. So that is just an example of one of the very successful mHealth application that is being used by community health workers in Tanzania. It has been scaled up in the whole of Zanzibar, and we have very grateful and very successful results from Zanzibar, and now it's also been scaled in the mainland Tanzania. So maybe just in short, I have only 1 minute here. We have also other great initiatives that are going on. We have the Big Results Now, if you have heard about it. It's a presidential initiative, and basically what we have identified is that there's a very big potential of using mHealth in helping to enable the achievement of the Big Results Now in the health sector. So we have identified areas which we think mHealth can be applicable. We know that we cannot use mHealth in every aspect of health. We have to be very selective where does it work and where it doesn't work. So we have identified areas with, especially on the reproductive and child health. We think mHealth it can work very well to reduce maternal, neonatal, and child health, but also in the area of behavioral change and communication, and also in the logistic management, tracking of medical supplies and drugs. So this is a presidential initiative, and the healthy sector came late, but when I was coming here, we had just finished the 6 weeks of brainstorming and prioritizing what we are going to do in the Big Results Now. So because of the time, I'll just end there. And
thank you very much. We'll come back in a few minutes and ask you about the public-private partnerships and the challenges there. let's now move to Dr. Chiwoza Bandawe, who I've asked to represent the end users on the public side and maybe share with him his perspective on public-private partnerships and what you think are the necessary components for successful partnerships from your perspective.
Thank you very much. So, yes, I'm Chiwoza Bandawe. I'm based at the University of Malawi, which is a public university. And I've been involved in the Department of Community Health. I'm currently in the Department of Mental Health. And I have several other roles, including being editor of the Malawi Medical Journal, which is part of the African Journal Partnership Project, which is very much involved in IT and taking information beyond the journals. With regard to private-public partnerships and successful, I think the starting point for me really is the issue of what is meant by partnership, and in particular defining who the partners are, because if we are going to talk of a partnership with regard to health, it needs to trickle right down to the household. It needs to trickle right down to the community, because the community are an essential part of that partnership. What typically tends to happen is that funders or donors or program people will come in with an agenda already set and expect the community to just, comply with it. And very often communities feel left out, even when the results come. At the end of an intervention, there's hardly any feedback at times to the community. So if there's to be a partnership, the partnership must trickle right down to the household. That is very key when we speak of partnership. That links me to the next issue, which is the agenda. Whose agenda is it? Because a partnership means it's something that you and I, or both sides, come together and agree this is what needs to happen. It's not a coming together when I have already decided, sitting in my office somewhere, that this is what you need, this is what is needed, and then ask you to then partner with me to achieve it, to please my funders. It's coming together and saying, well, in this context, what is needed? What do you require right here in this local context? What are your priorities? What is important for you with regard to IT, for example? And that is very important and very key, because yes, money talks, they say, but very often in terms of sustainability, where there isn't that collaboration right at the outset, then there isn't going to be that sustainability. And it really leads on to another thing which is often neglected about engaging or about an effective partnership, and that is the symbolism or the meaning of that partnership. And when we speak of the symbolism and the meaning of that partnership, very often we need to understand in the local context what this intervention means. So if, for example, I go into a community and I distribute cell phones to healthcare workers as part of the intervention, that may shift and change the power balance within that community, because it may now mean that the healthcare worker overrides the chief in terms of having power, in terms of having resources, and that can actually upset the status quo. So in order to avoid that, because there will be a shift, in order to avoid that, it is very important that the symbolism, the meaning, is understood, or what the implications are. There are examples that we've had of where bed nets are distributed, but they are used for fishing instead. There are examples of where you will come in, you encourage people to dig pit latrines, but and you believe that the digging of pit latrines is for the purposes of sanitation and hygiene, but as far as the people are concerned, having a pit latrine is a status symbol. It means something completely different. It doesn't mean that it is for, for hygiene. So that, I think that is also very important. Let me also just speak about equity it's very important that equity is there, because what tends to happen is that things seem to flow in one way. What I mean, at the university, for example, we have lots of collaborations with organizations coming into the country and wanting to, to link up with us, with technology, with a wide range of programs. And then what will often happen is that you will have people coming into the country, flying in, spending time in the country, yes, contributing, but there will hardly be Malawians going out, right? So it is very much one way. But there is an example of success that I want to conclude with, where with a university in the UK, in Scotland, that worked both ways. They came, they asked us what our needs are in terms of IT. They helped us at our university to establish the curriculum management system and all that, which really changed. They took our technical staff, our IT specialists, to the UK for training and to understand what happens and to understand how this can operate in the local context. So that's an example of a successful partnership. So all these things need to be considered when speaking of a public partnership. Thank you.
Thank you very much, Dr. Bandawe. That was excellent. And I'd like to now turn to Dr. Roger Glass, who's director of the Fogarty International Center of the National Institutes of Health. And I've asked him to reflect on the perspective as a supporter, donor, if you will, from the public side of education, and particularly around research, his perspective on successful public-private partnerships.
Thanks, Bob. And I must say I'm delighted to be in Dublin, even in the rain, because Fogarty, the namesake of my institute, was an Irish politician from Rhode Island, a contemporary of John Kennedy. So this is a return to my roots, and I have to take a photo of the Fogarty locksmith shop down the street. At Fogarty, we've had a number of projects in mobile which are really quite innovative. One is a new proposal to get evidence for mobile health through an mHealth call for proposals. And Laura Pavlich, who's been here for the last couple of days, is our project officer. And we hope in the next meeting we have, we'll have lots of results from these activities. We've also supported e-learning in 12 schools in sub-Saharan Africa through the MEPI program, the Medical Education Partnerships Initiative. So there again, investment in e-learning to provide real value in sub-Saharan Africa, but absolutely requiring broadband access and internet access. So for partnerships, we've seen through these programs 3 or 4 different models of partnerships. One has been with governments themselves, and the government, for instance, in Zimbabwe, seeing that we were globally investing in medical education and health education, the Minister of Education said, wait a sec, that medical schools are what I should be investing in, so I'm going to invest more, and it really attracted local government investment. In Tanzania, when the KCMC put in a e-learning activity and did really amazing things with e-learning, the Minister of Communications came in and said that the broadband services would be made free to that university to continue this amazing development. I really want to thank Graham Love for congratulating Charles Miuri back there. Charles, congratulations. He is a product of this partnership in KCMC, and I think it's his program in e-learning that's going to filter out throughout Tanzania and perhaps East Africa over the next couple of years if he renews his proposal well. So it's a nice recognition, Charles, and a challenge for you to go on. The other partnership is with donors. We've had nice partnerships with Wellcome on areas of common interest, and we've been involved in research and genetics in Africa, but using broadband to network people throughout the system, and with Gates Foundation. With public-private partnerships, and Reza and Craig, you're on our private sector partners, we've done things that have been quite innovative. In Botswana, they've introduced tablet PCs to all of the students, and it's been done through a private partnership with Samsung, which has provided for free the tablets, but the telecom is provided a tiered price for medical students so they can have access for their studies and their interactions at a subsidized cost. These will be the next lifetime users of the internet. They're the early adapters that you want in a society. They're the ones that are going to teach others and the next generation and their professors the value of this connectivity. So there are opportunities for those kinds of experiences. And finally, we've worked with the Global Alliance for Chronic Disease, a consortium of about 12 countries that are investing in global health initiatives for implementation. The first call was on hypertension, the second was on diabetes. Both of those could profit from mHealth applications to introduce these and document their effect and impact in low-income countries. Another source of funding for all of you interested in mHealth and developing evidence. So what does the future be? Why should we be all here together? I think in 10 years, I'd love to see in sub-Saharan Africa, for example, broadband in all of the schools, all of the hospitals, tablets and smartphones with all students so they could access the global literature. I see the tablet PCs now as more important than a stethoscope for the next generation of physicians and for the continuing medical education throughout. So I think that could be a game changer in low-income countries, just like turning on the electric was in the United States. Knowledge can change outcome and really improve health, and I think that's the study we want to say. So partnerships will be critical to achieve these changes over the 10 years. We can't do this just from the government community, the donor community, or through partnerships just with the countries. We need much more. NIH has never built a broadband network. We've never made a vaccine and distributed it. So that partnership is absolutely essential. I have to thank, in closing, Bob, I have to thank you for jiggling me and my partners to join this meeting, and Tom O'Callaghan for encouraging and bringing us here to Dublin, because I think this meeting has kept me engaged and excited about some of the presentations that have been made. And I've taken a ream of notes and sent notes home so we can follow up with many of you and continue what's been a very active interaction. So thank you very much, and congratulations to you and to the staff that's made this all possible. I'm absolutely delighted to have been here and met with so many of you.
Well, thanks, Roger. And I'd like to invite anyone who needs to corner Roger for the information about the grant applications.
Fogarty, I'll give you very easy to remember, the Fogarty Institute. Remember that Irish name, John Fogarty. If you just Google Fogarty International Center at NIH, you'll come right to our website, and it has all the calls on a monthly basis. And also, I would encourage you to go to another website, worldreport.nih.gov. worldreport.nih.gov, which has all the research that is done by NIH in Africa and Asia, but also 8 other donor agencies, including the Canadians, Australians, the French, the Wellcome Trust, and beyond. So there too. And I also want to recognize Paolo Miate from NIH as a convener and another one of our NIH partners in-house.
Well, thank you. So, Dr. Bendawe mentioned a number of key issues that are important for successful partnerships, and one that sort of struck a chord with me was identifying a shared agenda, or reaching a shared agenda or shared goals. Let me invite the audience to offer their own thoughts and questions about successful public-private partnerships, and then we'll have the panelists respond. Any questions? Reza?
Thank you very much. Well, Dr. Azad, probably this question is for you if you can hear me. I have the pleasure of serving on the UN Broadband Commission with your wonderful friend and citizen of the world, Dr. Muhammad Yunus. So as you know, he is a symbol of public-private partnership, starting putting his own money where it is, but now attracting so many other governments and other private sectors, other groups coming in. Can you see the model that Dr. Yunus has started for the bank, again, the banking and microfinancing, and the Grameen Bank that he started, of course, with the telecommunication being an infrastructure for it, can be repeated in other parts of the world? And what are the success stories and lessons learned that you can share with us? Thank you.
Okay, thank you very much. Actually, virtually during the last decade, and Bangladesh actually successfully reduced the poverty rates in the country. And actually we are now trying to actually take Bangladesh to a new height, to a middle income country by 2021 and to a developed country by 2041. Actually, the root of this success are actually the employment generations for the people. And of course, microcredit actually has done a lot actually toward this success. Bangladesh's one of the important successes is its mobile phone density. And we have got 160 million population. And according to statistics from the last September, that we have got about 118 million actually subscribers of the mobile phone. So, you know, that is one of the important things that Bangladesh has been so successful in taking the connectivity to the rural areas. Virtually every point of Bangladesh is connected. And all the community health workers by the Ministry of Health and Family Welfare, all the community clinics, all the just immediately upper level daycare clinic, all the public hospitals, these are connected. So we are actually taking advantage of this connectivity in Bangladesh. And this has been possible by broadband communications. And we have got 6 operators in Bangladesh. But the Grameen Phone, which Dr. Yunus has started, actually this is the largest operator in the country. So Ministry of Health has actually taken connections from the Grameen Phone. And actually there is an excellent example of partnership between a mobile operator and the government. There is an usual subscription rate for actually normal subscriber. But actually it has given a special rate. It's a very actually lower rate for the Ministry of Health and Family Welfare so that we can maintain the connectivity. So this is one of the examples of the private-public partnerships. And not only that, there is a Grameen Solutions. This is a subsidiary of the Grameen Phone. Actually, these Grameen Solutions also actually developing software for us, as well as actually they are implementing health services which we can actually use or we can take to the people with the help of use of ICT. And in actually, while government of Bangladesh has taken this connectivity to the lowest level community health workers or community clinics, here also we have got actually role of partnership between the development partners as well as by the government. We have in Bangladesh, the development program is implemented under a sector-wide approach. This is a joint planning process and joint actually resource mobilization process between the World Bank-led consortium, other bilateral donors and government of Bangladesh, as well as the private sector. So we do the plan together. So the funding for expanding the connectivity throughout the country is being provided from this joint fund. So this is one of the examples. I have seen that, you know, among the audiences, we have got Dr. Amal Lavrik, the Associate Professor of Johns Hopkins University. They are also experimenting for us for actually developing software solution, in-health solution, so that, and one of the great example can be OpenSRP, Open Smart Registry Platform. So we are actually using open source software called District Health Information System as well as OpenMRS for gathering the data from the community health workers as well as the hospitals and the clinics of Bangladesh. But traditionally, the health workers, they are actually habituated to use the paper register. So this Open Smart Registry Platform is actually a paper, like a paper device. So when the health worker will actually power on the electronic device, the handheld devices, they will see the pictures of the paper register. So if they click on any register, they will see the rows, and each row actually have as a citizen of Bangladesh. So if you click on the name of the citizen, an electronic form will be actually displayed. And if he updates the form and submit this, it will be actually submitted automatically and instantly to the National Data Center. And it will have actually automatic dashboard report accessible to all the stakeholders and the public. So this is the development, and definitely this model can be a good model for other countries, particularly of the developing countries, and where actually citizens, they are empowered actually to use these devices and to improve their own health.
We have time for maybe one more question, and then we're going to wrap up. Let me turn to our panelists, and we'll start down the end and work our way back. Let me ask you just to make a few final comments with specific reference on what you think, how would you measure success for a public-private partnership? I mean, what are the metrics of success? What needs to be in place from your perspective? In addition to what you've already mentioned, Dr. Bandawe, do you have anything else you'd like to leave us with that you think are important for a successful partnership?
Thank you. I think one of the important measurements is the sustainability of the project or program. And that can be measured several years down the line. But if one achieved one's objective, and it is something that is continuing and is not only sustainable in the sense that it's just, it's still there, but ownership has been taken over by the community, then I would say that that is a very clear indication of success. So the sustainability, the ongoing way, the ownership, because once people show ownership, that is an indication of successful private-public partnership for me. So the measure of success is down the line. Thank you.
Thank you. Dr. Mwewenisi, what would you say are your final suggestions on necessary steps, necessary characteristics of public-private partnerships?
Thank you. I think I'll go straight to what I think it's important, especially to have successful public-private partnership. And because of the time, I'll go straight to the point, but otherwise I would have given an example of a very successful public-private partnership project in mHealth in Tanzania. It's called Wazazi Nipendeni. I think you have heard about it. But I think what is needed, I have few which I'm going to point out. The first one I think is, first of all, to have legal and regulatory framework. We need to have in place a framework that guides what is the public-private partnership model going to work in each sector. And therefore, here it includes also having, on the government side, set policies. Yeah. For example, in Tanzania, we already have the National Public-Private Partnership Policy, and for each sector, for example, for health, we have Healthy Public-Private Partnership Policy. It is important to have these frameworks in place. The second one is having a common understanding, yeah, between the two parties. How is the partnership going to work? And also to highlight clearly what are the roles and responsibilities of each of the parts. And the other one is transparency and accountability on both sides, the government side or the public side and the private side. We need to have transparency and also to be accountable for what we want to achieve or what we intend to implement. But also there has to be a mutual benefit. It means that it has to be a one-to-one kind of partnership. It's not maybe a private organization or a private entity providing money, and no, I think we have to be very careful in the way we develop the model of partnership. There are so many factors which can go into the partnership. It doesn't have to be money. It can be management of the project. And so money is just one entity, but there are so many factors which can go into the development of the model of the partnership that we are talking about. And also the other one is about having sustainable plan for the project. Because we have seen, especially in Tanzania, we have so many public-private partnerships projects, but unfortunately they are not sustainable. I think because of so many factors which I've mentioned, one of it being transparency and accountability. So I think to wrap up, that is what I can say. Thank you.
Thank you very much. Dr. Glass, any final suggestions on successful partnerships?
I think she just said it all. I thought that was, I couldn't say anything better, and I thought you did a wonderful job. I would add that the Institute of Medicine in the U.S. is now involved in looking at public-private partnerships, and they've got a group of about 25 of us from both sides trying to see what can we do to make these work better and what are the conditions, and there should be a report on that in about a year, and I think that'll define some of the things that my colleague has said, articulated so nicely. We should have put you on the commission.
Oh, I'm happy to be there.
Thank you, Roger. Dr. Azad, I'd like to ask you if you'd give us your final recommendations for successful
Yes.
partnerships.
I think that actually the success lies in the culture of working together between the government and the private sectors or the non-state sectors. And actually we have got resource constraint, this is true, and in every country this is true. But if we work actually isolated, actually we waste resources. So if we work together and if we actually strengthen this culture of working together, actually we can make efficient use of resources. So in Bangladesh, actually we have understood this. Initially we invited our partners, and actually they were our partners, but probably they had a culture of working isolated, separately. Then actually we have identified the common platforms, the common fields where we can work together. So actually this is improving and we are getting results. So now other partners actually who were outside this collaboration, actually they feel isolated and they're increasingly coming into our partnerships. So this is one of the actually achievement we do. So virtually the thing is that we have to make the plan together. We have to actually review the successes together. And if almost all or all of the partners are satisfied with the results, so this will actually say that we are successful. So I think we have to actually nurture this culture of working together.
Well, thank you very much. That's an excellent final comment, and I'd like on behalf of all of us to thank our panelists, especially Dr. Azad, who stayed up quite late for us this evening. But if we could give our panelists a round of applause, please.